Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, Ansi van Walt and Anae dive into the ethical dilemmas surrounding chronic pain management in today's podcast episode. They explore the intricate relationship between our beliefs about pain and how these perceptions impact our clients and patients. The conversation touches on the importance of education and community support in chronic pain management, along with setting realistic goals and expectations to guide clients through their pain management journey. They also discuss the tough choices involved in end-of-life care and share a sneak peek of what you can expect from the Vet Rehab Summit 2024. Now, this is our annual veterinary rehabilitation conference. It's happening on the 31st of August this year. Last year, we had over 5,000 vet rehabbers from 71 different countries registered. You're not going to want to miss this. You can find out more at www.vetrehabsummit.com. Before we head over to that chat, a quick word from our sponsor, Curacao Vet, which is owned by Nada Robinson. Nada first developed her courses at the Colorado State University, where she started the medical acupuncture for veterinarian certification program, and that was in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. The courses they have include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curacao Vet at curacao.org, or you can also see them at this year's Vet Rehab Summit on the 31st of August. All right, over to Ansi and Anae.
Hi, everyone, and welcome. Hi, Ansi. Thank you for joining me.
Hi, Anae. Nice to be here. Thanks so much for inviting me.
Absolutely. It's always good to chat with you, Ansi. You always come with some really interesting thoughts and ideas, and it gets all the cogs turning in my mind. So I always love chatting to you and learning from you, especially about subjects that are not necessarily clear, where there isn't a right or a wrong or a best pathway, but where we have to be adaptive in our approach. And this subject definitely is. So for those of you who are joining us, we are speaking about chronic pain management, and specifically looking at our ethical responsibility in that. And of course, this topic comes from our Vet Rehab Summit topic, where we are looking at the ethical challenges that we face as vet rehabbers. So this is one of the avenues we'd love to explore. If you are joining us live, please feel free to ask questions and join the discussion. We're here to be chatting with you and learning with you guys. So as I've already mentioned, with so many of these things, there isn't one clear right or wrong answer. It's about finding what is ethical for the patient, what is ethical for us, where are our boundaries, how do we find those boundaries, and then finding the best way forward. All right, so Ansi, will you please introduce yourself and your interest in our topic today?
Thanks, Anae. Yeah, so for listeners who don't know me, I'm Ansi van Walt. I'm from Johannesburg, South Africa, and I've been in private small animal practice since 2001. So I was trying to count it on my fingers earlier. I think it's 23 years. And I became really fascinated with chronic pain because it is so complex and so interesting. I think some people might find it really frustrating, but those are exactly the things that I feel make it such a challenge and so rewarding if you can overcome those challenges. So with chronic pain, we just deal with so many different interests and beliefs and expectations from the owner, the welfare of the dog or the animal itself that we have to consider, the expectations of our referrers, the vets, the surgeons, also want to see a successful outcome for that pet, and then they have their own definitions of what a successful outcome is, which may be different from the client's. So just talking about having lots of different balls in the air, dealing with a chronic pain patient is very much a juggling act. So yeah, it's a fascinating thing, and it's a fascinating challenge that really, really interests me.
I love that. I think it's always interesting when we're new graduates into rehabilitation. We love the straightforward orthopedic cases, and then the longer we're in the game, the more it's neurological cases because they're interesting and challenging. And then I think at some point it becomes like this chronic pain game because there's so much to think about, and I love that. And I like that you brought up the beliefs and expectations of owners, because that can be very challenging to work with in some cases, sometimes not, and sometimes very challenging. And then what the referral vet might say this is a successful outcome versus what you think is a successful outcome versus what the owner thinks is a successful outcome. Those can be really different as well, and then difficult to bring together. So if we kind of focus in on our ethical responsibility, what are the thoughts that come up for you? Because it can be a little bit of an out there question, a little bit vague, but I have been asking you to think about that for a while now, bringing up the summit. So what do you think about when we say, what is our ethical responsibility when it comes to chronic pain management?
I think the most important starting point when we deal with chronic pain patients is that we cannot forget that is exactly what they are. A chronic pain patient is not a patient where you have a solution or an answer or a fix for their pain, which is why we are 3 months, 6 months, or a year or plus down the line with a patient that we're not successfully completely managing their pain. And then the definition of what managing that pain means starts to take on a new meaning. And you have to start to shift your definition of what your goals are for management, because the norms in society and the expectation from society and the expectation, perhaps even from most councils, are that pain equals suffering and suffering is bad, and allowing an animal to be in pain means that you're allowing them to suffer, and therefore pain is the enemy and we need to get rid of that at all costs. But when it gets to the point that this is really just not a realistic option, where do we go from there? And what is the right choice for that particular patient to shift from a situation where we're looking at how can we fix this pain, because this is maybe not a feasible option, to how do we allow and support and help this patient and their family to live as well as possible and with as good quality of life as possible, despite the fact that there may be some ongoing pain present. And that's completely possible. And that is going to look very different from one patient to the next, depending on their context and the family situation in which they are. So that's where we need to really start to include the client very much in how we plan the way forward and the best options for this particular patient. The other thing I think is that becomes really tricky, and that we may tend to want to avoid thinking about because it's so complex, is the idea of informed consent when we're getting to interventions where we're targeting chronic pain, because it's very hard sometimes to have the conversation with clients that effect sizes of what we do might be really small, but we think they should carry on with it. It's going to be a long-term investment. It's going to be a long-term journey. We're not fixing anything. And we need to have these conversations up front. Informed consent does require that everybody knows what to expect and what the possibilities are and what the evidence says about things. And realistically, what we're are able to do might not always be a huge change. And that is part of the commitment we're expecting clients to make. So it often is a lot of tricky conversations, but important conversations at the start of an episode of care.
Yo, that really is, I mean, it's huge if we think about, I think that definitely does challenge my belief when you said pain equals suffering equals the enemy, right? It just, we don't want our patients to be in pain. Can we just not have any pain? And that, so that, you saying that brought that kind of feeling up for me that, well, that is something that maybe I need to reevaluate and think about, because it isn't possible at some point for us to fully control pain. So how do we look a little bit more deeply at that relationship between what does pain mean? Because pain does have a valuable role in the body, right? It is there as a protective mechanism, and then when it becomes chronic or it becomes out of control, then that's no longer useful and helpful. So how do we adjust our perspective around pain and our relationship to pain so that we can find the best way to help our patients without our own beliefs hindering us?
Well, that's a really, really good point that you make. And I think what you touched on there is our own beliefs and our own previous experiences, maybe with our own pain or pain with members of our family, also informs a lot of our beliefs around pain. Mm-hmm. And it just, somebody once referred to pain as the signature of humanity. It's kind of that thing of, the morning that you get out of bed without, any pain, that you're dead, sort of thing. And but pain is part of life. And as you said, chronic pain stops having a functional role in terms of being protective, in terms of allowing something to heal. Generally, when we get into the chronic pain space, there's nothing that needs to heal anymore. And we start to then also deal with the fact that, especially when we look at the medications for chronic pain, they start to have a side effect profile that starts to be much bigger than their benefit, which also then goes into this whole balancing act of where you want to go with this. I think what might, what's quite helpful is I've got a client at the moment where she's needing to find this balance between a dog that's got limited options for pain medication because of liver and kidney issues. The options that she has high side effects. Mm-hmm. The other option is for the dog to be in an unacceptable level of pain. She doesn't like either, but somewhere along the line, our role is to either help the client find a midway that is acceptable for them and their perception of quality of life for the dog, and that we help them accept where the dog is at this point in their journey. And not everybody is ready to start looking at it from a point of view of some compromises need to be made at this point. Right? So our ability to deal with the other end of the leash and the emotions and the beliefs at the other end of the leash definitely come into play there, as well, quite rightly, as you said, our own perceptions around pain and our own beliefs around pain. I think the other thing you touched on that's really important is, how do we evaluate pain and chronic pain? Because the reality is we've got a lot of tools that we can say, okay, fill in this load questionnaire or the Helsinki pain index, but ultimately those are all proxies for pain. We're looking at behavior and movement, trying to make a judgment on the dog's level of discomfort based on our observation, and that also brings in our perception of that observation. And there's a lot of things that inform a dog's behavior. So it is definitely very, very, very complicated. And I suppose then we also start to need to look at the benefit of placebo.
Okay, so we could definitely go into that. I think let's expand on objective pain measurements like the Helsinki Chronic Pain Index and the Canine Brief Pain Inventory, and where their place is in managing chronic pain patients. How do we use them? Do we want to use them? How important are they to be incorporating, and what value do they have for us and for the owner?
So my personal experience, and let's just start this off by saying that something like the the Canine Brief Pain Inventory has been validated. So it's definitely an effective way of measuring the amount of certainly nociception that a dog is experiencing and how that's affecting their locomotion. But I find for me, I don't use those tools very regularly in practice. Number one, people get questionnaire fatigue, and they're not that motivated to constantly be thinking, oh, is it a 4 or is it a 5? Is it a 7? Maybe it's an 8. I don't know. It's too hard. Let me not even bother. And as soon as you, especially if somebody's already really worried or stressed about their pet, and you, number one, doing two things by making them fill out this questionnaire, you're increasing their cognitive load. So you're adding almost like they're needing to do a test now, and as much as you can say, don't worry, it's not, there's no right or wrong, it feels like it's important because you're making them do it. And the other thing is that you are really making the client very focused on the pain, where we want to, with chronic pain management, start to shift their perspective to the pet's ability, despite what they're dealing with physically, rather than their disability. And these questionnaires do have a bit of a focus on the disability, which can be useful in certain contexts. Personally, I prefer to find out what that particular client's main pain point is with the dog. It's always worth thinking about the concept that the dog or the cat or the horse or the guinea pig or the rabbit, whatever it is, they're not phoning in and making the physio appointment themselves and bringing themselves to physio. The party in this whole chronic pain universe that is making this decision to look for help, to seek care, is the caregiver. And there's something that is making them worried and stressed. And that could be the dog's not managing to go for walks anymore, can be the dog can't get onto the bed anymore. And if you can focus on that thing, I think it's far more useful also in terms of measuring progress, because what they want is in some ways, considering that our assessments of dog pain or pet pain is subjective, and we're trying to imagine what the dog's feeling. They're actually coming with a problem that they are experiencing because of what they experiencing with their pet. So my dog can no longer get on the couch to sit next to me, or my dog can no longer go for a walk with me. So it's far more useful to hone in on that pain point. What is it that person can no longer experience with the animal that is causing them enough distress that they're looking for help?
Okay. No, I love that answer, because it's like I said, different, right? You you always come with a different perspective or thought, which I really appreciate. So I would have thought that for these chronic pain patients, it is even more important to be using something like the Canine Brief Pain Inventory, so that we can monitor that change over time in as accurate a way as we have available to us. And I do think that is important, but I completely hear you in that they could be experiencing complete overwhelm with the severity of what's happening with their dog, with the progression of what's happening, with the decisions that they have to make, weighing up the side effects, the consequences, where they have to find the middle ground. There's always a compromise to be made. So I completely get that they could be experiencing just mental overwhelm. And this will definitely add to that. And it'll feel like they have to Yeah, no, I completely understand that experience that you're describing. I think the CODI, the what is it called? CODI.
Cincinnati Orthopedic Disability Index.
Yes, that one might be the best middle ground, because I think it only has 4 questions in it, and it focuses on the thing that is the primary problem for the owner, instead of listing all the things that it could be and then having them score it. 4 questions: what is your primary issue, how would you rate that, etc. And so you're getting the best of both worlds potentially. So I would lean towards that one in that kind of scenario, which I like. Okay, so let's talk about the kind of pain management pyramid. I love that way of phrasing it, because we're building things on top of things, and that's so much more important for chronic pain, because we need long-term outcomes, which means we need multiple interventions, starting with what is least invasive and most effective in the long run. So how do you see the pain management pyramid? Where do you start? And then how do you build and layer on that?
So 100%, it always comes down to education. Client-centered education is the most important foundation for that. And it ties into managing expectations and helping communicate with you as the veterinary care provider what's actually happening at home, and communicating clearly about what they're seeing in their dog. The tricky thing is that it's very hard to always build that into our clinical time. And there is actually evidence starting to emerge that if you just throw the information at clients, very good information, very evidence-based information, not even that it goes over their head, it actually increases their fear of pain and their fear of their pet's pain, and it makes them feel less capable of dealing with it. Whereas what we're trying to achieve is creating a partnership, a therapeutic alliance with the client, that they are part of the team that's helping managing this dog's life on a day-to-day basis. We only see them for maybe a half an hour or hour once a week, once every 2 weeks. The client is dealing with them on a day-to-day, minute-by-minute basis, and they need to be active partners in managing the dog's condition. So for them to do that and be engaged, they need to believe that they have the capabilities to have an active role to play here. And one needs to provide education about chronic pain in a way that you can allow people to sort of process the information in a way that's very relevant to them and very relevant to their particular context. And the tricky thing, as well, as though this is not all complex enough, is to work this into your billing plan. How does this get paid for, right? Because it's not clinical time as such. And it can take, depending on the client. Some clients are, really easy and have a high level of self-efficacy and are confident and have gone through this before, and other clients have a lot of anxiety and stress and insecurity. And you almost do need to be there as a support system for them. It's not necessarily billable hours. So
yeah,
it does add into that.
Building those relationships, right? So let's expand on education and how we can support our clients, because it's really fundamental. And I think it's something that a lot of us find it can be highly rewarding, because we're creating really great relationships with really great people. But it can also be highly draining, because we are creating dependent relationships sometimes with people that are very dependent. So finding those boundaries, creating those boundaries, and having the best education structure for our clients would be a good way to work around that, or to help minimize the stressful component of it and maximize the beneficial component of it. So what is your strategy? Do you have educational resources that you're sharing with your clients? Do you run workshops so that you can have multiple similar clients together learning skills? in with more time, so that you have more than just an hour. They can practice different techniques. They can understand different concepts of pain. How do you work that into your practice?
So my pain education programs are 100% online. And
Okay.
the nice thing is there is a lot of evidence to show that online pain education programs can be actually even more effective in some case than hands-on treatment. Let's not put that out there too much. But I do a hybrid component. So they get some material that they work through. But also then when they're in the program, there's a weekly group session and a group meetup, because there's really important components of being in a group of people going through the same thing as you are. So it's great to sort of be in a situation where you can hear other people's experiences, that people can learn they're not alone. They're not the only people that have a dog in chronic pain and that they're struggling with and have emotions about. It also really allows them to start interpreting the information that you gave them for their own individual context and how it affects their particular pet and their particular life. And they need to be able to ask those questions and practically start to play around with what their options are of implementing this information. And to do that, you have to have not a face-to-face, but a virtual face-to-face session. You can't just think that they'll be able to extract what they need to get full value out of the information that you gave them just from reading material or even podcasts or videos, because it's going to be too general. And then they often go, well, that sounds great, but my dog's different or my horse is different. So that is really important. And we have to facilitate that process. Go, how about, have you thought of trying this? How about this week you try this and next week you can tell us how it went? So you have to have that component into it.
I think that is a really valuable way of doing it. I love the idea of having group sessions, because it means that, you know, you're creating that community where they have the same challenges, the same problems. They start to support each other and learn from each other. And when it's time to grieve, when it's time to make compromising decisions, you're not doing it alone. You don't feel like you're alone in that space, which can be a huge, huge load off. I love that. That's very, very valuable. If we think about, for me, I always think with chronic pain management, the most important thing that we have to make sure is in place is that bottom tier of the pyramid, right? Education, weight management, and environmental changes, essentially. Are they all in place? So how do you go about checking those, encouraging those? Because they can also be the most difficult things to maintain. Right? What are your thoughts on some of that?
Absolutely. So any behavior change. So at the end of the day, a lot of the conditions we end up seeing in our clinics and our practices, to some extent, are a consequence of the environment in which the dog lives. I'm going to use dog as example throughout, but it can also be relevant in other contexts with other pets, but just because that is primarily the space that I work in. And behavior change is difficult, and I'm actually referring more to the clients and the family here necessarily. And because we do the things we do because it works for us. So the way our houses are set up, if I think of South African conditions, we all have laminate floors and tile floors because it's hot here and it's nice and cool to have those floors. They're not great for dogs. And we have that because it works. And the same as for everything else in our household. You know, dogs that chase the neighbor's dog up and down the fence all the time and gets recurring injuries that way. We kind of don't do anything about that because there's a lot of practical barriers to changing how we manage our dog spaces during the day. So behavior change is really hard. And just because you've maybe achieved it, so our pain education program is sort of a 5-week process, but it doesn't last unless there's ongoing check-ins and ongoing support. So everybody who's completed the pain education course does stay on, for us it's a WhatsApp group that you can sort of regularly check in on the group, and it's voluntary. You send them the link, they join, so you don't add anybody to anything against their will. But you can check in with everybody, just make sure everybody remembers about important things, remind them about, the things you need to try and avoid when your dog has got chronic arthritis. And it's the little things that people often don't think about. The elbow dysplasia dog that really shouldn't be jumping out the car. You have to just sometimes remind people about the type of behaviors that can trigger a flare-up and a pain response. Okay. So you do need to create a structure that allows for ongoing support. And it can sound like quite a lot, but the reality is that the people who don't need it won't engage with it and won't take up any of the time. And it's the people who really need it that will engage with these structures that you set up. And there's a lot of benefit to be gained to keeping those people feeling supported and feeling like they have somebody they can turn to when they get stuck, because that also keeps them in your little environment. And coming back to your practice, and you don't lose them because they give up because they can't cope.
Yes, yeah. Okay, I love that. So let's climb our little pain management pyramid and talk about some of the compromises that come into play when we start using medications. So the obvious one, we start with NSAIDs. We know that, NSAIDs have there's a possibility for ulceration and other issues, but that's generally where we start, and that one we understand and works well, and it's okay. But when we start adding additional pain management things, we can start to have consequences in terms of mentation and other abilities, other things happening in the dogs. So what are some of those scales we need to balance? What do you see in your practice as they start to use more medications, and what are the consequences, and how do you guide and help them through that process?
I think the answer to that question goes back a little bit to how an important component of when we implement a pain education program, a critical part of that we can't leave out is helping our clients set appropriate goals for where they want their dog to be at each life stage or the next step for their dog. Because when they first come to you, when they first go to the vet or to a rehabilitation practitioner, they come with the mindset of somebody must help take my dog's pain away. So helping them go through a process of setting appropriate goals for their dog will kind of help also clarify for them what their priorities are. And I'm going to go back to the example I used a little bit earlier. So the dog is very, very sleepy and sedated on the pregabalin, but that's kind of her only option between a couple of other options that are not much better. So it's a process of helping her decide her goal. Is the most important goal for her to have a dog that's in as least pain as possible? Or is her most important goal to have a dog that still participates in her family activities, which in her case is mostly just walks around the block as normal? And helping through that process of goal setting, that your client starts to understand that there is going to be a trade-off somewhere. And the more you go for completely managing pain, the more you might end up having a dog that is less capable of doing some of the normal things. And that seems counterintuitive, because in people's head, the lower the pain, the more the dog can do the normal things. But the reality is, with the stronger pain medications, it's not always where we go. So you have to help them see the journey ahead and start to go, which direction is going to fit best with my norms and values around quality of life and what I believe pets, how we should look after pets. And that may be very different from one person to the other. And it may be a bit of a process. I'm very happy for my 14-year-old old boy to just lie and sleep in the sun. It doesn't worry me. For this particular client, it worries her that the dog's no longer really as engaged. So unfortunately, that means there's not a straightforward answer to that question. It's going to be very, very individual. And that also determines where we go on this pyramid.
Okay, I love that. There isn't just one answer, and I think most of us have had the experience of having an older dog who needs more and more support, or a dog with hip dysplasia or elbow dysplasia or whatever the case may be that kind of follows that deterioration path. And all of this discussion is bringing up memories for me of Sasha, my hip dysplasia dog, who we had put to sleep, I think, a year or two ago, because I wasn't happy anymore with how I could manage his pain. And so let's talk a little bit about euthanasia, because this conversation wouldn't be complete without talking about end-of-life decisions that need to be made, and how we support our clients in that space. And I want to definitely dive into, because this is an ethical conversation, when our opinion differs from our client's opinion. So we are seeing this patient on a weekly basis. We feel that the pain is no longer under control. This dog is miserable. They're losing weight. They're not themselves anymore, but the owner wants to keep going. How do we manage that? How do we work in that space? What's your advice and your thoughts for end-of-life decisions?
So I must say the most effective strategy that I've found is to use the quality of life scales. There's a couple around now. I think Dr. Villalobos was the first one to really publish one. It was more specifically developed for intensive care setups in veterinary clinics. But I find it still really useful, although I will add a bit on at the end of talking through that. And they look at 7 domains. And it's not just, is my dog in pain, or it's things like eating and hydration. It is being able to keep themselves clean. So can they get themselves to the toilet, or at least are you able to help them stay clean with lots of bedding changes, and mobility comes into it. And also their ability to still have some social interaction. Dogs particularly are still social creatures. Are they still able to show interest in doing something? Do they still recognize their owner when they come in the door? Do they show positive signs and happiness when there's some engagement with owners? So there's these 7 domains, which really takes away from, is my dog in pain or isn't my dog in too much pain? So let's take it as a given that the dog is going to be in pain. If we're looking at a pain patient, when is it too much? All right. So I really find that helpful, because it takes my opinion versus your opinion out of it. And it says, fill in this sheet, and then it actually gives you a scoring. More than that, consider euthanasia. Less than that, you're probably still okay, but maybe you need to look at some other options of treatment. So I've found that very effective. It can be a bit difficult when there's a difference in how, say, a husband and a wife interpret things, especially if one's more home more often and sees more of it. So that can be challenging, and then they kind of need to sit down together and make and go through this form. But that's the most effective tool that I've found so far. But what's also really important, and it's almost a next version of these tools that needs to come out, is what is the impact on the family of this dog's condition? And it can sound like it's a selfish thing. People want to hate thinking that it's about the money, or it's about this or about that. But the reality is, ultimately, you get to a point with the dog that you're not heading in a positive direction. You're not going to fix anything. You're not going to cure anything. Is it really valid to, you need to consider what the family budget is, the family stress because of the cost, the effect on the owner's mental and physical health. A great example is a client I had a few years ago with a big German Shepherd, also with degenerative myelopathy. And it was really starting to take a massive toll on her spine from lifting him all the time and having to carry him out, carrying him back in, because he got to the point that he was completely not mobile. She felt that she had to be completely committed to him. But both of their quality of lives were actually not good.
Yeah.
So this, again, there almost needs to be an update to that tool where we can bring in a frank assessment of what is the impact of this dog's physical condition on everybody in the family and not just the dog.
I think that's really important. And you mentioned now that that client felt like she had to be completely committed to the dog's welfare. And I understand. I understand that. But I also so fully understand this thing where we have to sometimes put the family first or ourselves first. And it isn't, we need to realize that it isn't one at the cost of the other, right? When we make the decision to say, okay, this situation is no longer sustainable in our family and in our environment, and we make the decision to euthanize the dog as a result, that isn't bad for the dog. That is not bad at all, because they are already suffering, or they are already in a space where you've given them as much as you can. So really recognizing that kind of relationship is important. And I like that you've mentioned that needs to be kind of added into the 7 domains and evaluated. Yeah, thank you.
I think something else that I found useful is to say that ultimately, at some point, this dog will need to pass. And if it is this week, or if it's in 3 weeks' time, if the difference in those 3 weeks is just going to be more suffering for everybody, nobody's gaining anything.
A quote that made a difference for me was something along the lines of, I actually feel it's a gift that we can give to our animals to end their lives before they have to suffer excessively. I think it's one of the greatest gifts that we can give them. It doesn't always feel like that, but I do feel that way from my own personal experience. And what helped me come to that is, it's better to end a life 5 minutes too early than 5 days too late, or 5 days too early rather than 5 minutes too late. They don't need that extra 5 minutes of suffering. They don't. So that one helped me.
Yeah, that's also a valuable one.
Yeah. Okay, so let's switch gears, and talk a little bit about the summit and what we're going to be learning there, because you are one of our lecturers for the Vet Rehab Summit, and you're presenting three.
Yeah, I think it's just
three. So you're going to be talking about placebo treatments in evidence-based practice, whether that's ethical or not ethical. And you mentioned the placebos earlier, so maybe you want to give us a little bit of an idea there. And then when pain-free is not an option, and end-of-life care decisions. And I think I'm really looking forward to all 3 of those. So tell us a little bit what we can expect from those lectures.
No, absolutely. And I think we've touched a little bit on end-of-life care decisions, and we'll expand a little bit more on how to decide for, in your own personal and family context, where to go with this decision making. With when pain-free is not an option, we'll dig a little bit deeper in all the ways that we can help our clients and their dogs allow the patient, their pets, to live well despite pain. Just coming to this point that pain in itself is not the enemy. It's how we shift our perspectives and the changes we make to allow quality of life to still happen regardless. And then, yeah, placebo. I'm very much looking forward to that. It's a fascinating topic, and I'm loving how this lecture is shaping up. So very, very excited about that. And just where is the ethical fine line? Because placebo can be very powerful, and it can actually have immeasurable effect size. So is it, all the studies are everything against placebo, but if we can really leverage placebo and optimize that in a way that is in our patients' best interest and improves their quality of life, we really should be doing that. So we'll be really doing a deep dive into that as a concept.
That is so interesting. I can't wait. I can't wait. So, guys, the summit is on the 31st of August. It's a Saturday. Please book that day out in your diaries because you want to be live with us. If you're an Online Pet Health member, we register you automatically and you have free VIP access to the Vet Rehab Summit, which is phenomenal. If you are not a member, ticket sales are going to be opening very, very soon. I think within the week. We're almost there, or it will be early next week, but we're going to let you guys know as soon as they open. So yes, thank you so much, Ansi, for your time today. I really appreciate it.
Thanks so much, Anna. It was a lovely chat. Appreciate it.
Awesome. Bye, guys.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.